We have our first speaker of the webinar, Commander Srirang Bijur. He is president of Parivar, which is the National Confederation of Parents Organization. Parivar has 300 organizations affiliated with it. He is a parent and has wide-ranging experience in advocating for empowerment of persons with intellectual disabilities, as well as collaborating with central and state governments for forming policies, schemes, and provisions to benefit PWIDDs. Commander Bijur is also president of AWMH Maharashtra, which is one of the oldest organizations in Maharashtra, providing early intervention services to children from Mumbai slums for the past 40 years. He is also closely associated with many other grassroots organizations. Leading among them are Nirdhar Pratishthan, a residential home near Virar, and many schools and vocational training centers. Commander Bijur is also focused on capacity building of parent organizations and developing leadership among the parents and professionals to undertake positive interventions during COVID-19 period. Earlier, Commander Bijur was in Indian Navy for 20 years and served on board four warships: INS Talwar, INS Betwa, INS Taragiri, and INS Godavari, apart from being Deputy Naval Advisor in High Commission of India in London. After retirement in 1995, he served with corporates in leading position for around 20 years. We are very pleased to have Commander Srirang Bijur sir as our first speaker. Over to you, sir. Bijur sir, over to you.
Jai Hind, Professor Mukesh, and all the parents, persons with intellectual disability, professionals, and participants who are hooked on in the screen today. I am going to speak on isolation and quarantining of persons with disability, challenges and guidelines. Being a parent and also from Parivar, I am going to speak basically the experience of parents, what we face, how we can get over it, and how we can enjoy both isolation and quarantine even when it comes to us. Now, what the parents feel and what they should do can be summed up in four sayings. I'll come to that. जिन्हें हम वक्त देते हैं वह हमारी कदर नहीं करते, जो हमारी कदर करते हैं उन्हें समय पर वक्त नहीं देते. All parents understand this. The second is, if you are persistent, he will get it. If you are consistent, he will keep it. This is again for our persons with intellectual disability. It costs ₹0 to respect your persons with disability, meant for all of us in the society as well as in the country. Stop trying to calm the storm. Calm yourself. The storm will pass. Again, this is meant for all of us in the COVID time. Now, I can as well finish my presentation if the parents understand these four axioms. Let me go forward and see what all the storm is about. Now, the person with disability is fortified by his family and caregivers. Now, generally in case of intellectual disability, the caregiver is primarily the mother and the family. In some cases, it could be some outsider. The second ring of fortification is given by the COVID care, which is hospital, police, all those who are into COVID care profession today, and also the community. And the last ring is formed by the government measures, whether it is stopping national and international flights, whether it is declaring isolation or lockdown. These are all government measures. But what I say again is, when you have intention, the universe will make it happen. If we want to keep ourselves safe and the person with disability safe, it will happen. Let's see what the person with intellectual and developmental disabilities, what they experience. Now, I want to clarify here that since I know it is conducted by National Institute for Empowerment of Intellectual Development, my focus will be mostly on intellectual disability, but most of it is also applicable on the other disabilities. Now, whatever is required for other disabilities, I will mention it there. Now, for intellectual disability, what they experience, change in their daily routine, which is the foremost kind of challenge they face, because they're so used to a routine, they get fixed up to their routine. Restricted space and movement, everyone feels it, including them. Hardening attitude of mother and primary caregiver, mainly because the mother is too busy nowadays looking after the demands of so many people sitting at home. Unfulfilled daily essential needs. Just for an example, like a person with intellectual disability may like to have non-veg every day. He may not be able to get it. Issue of hygiene and sanitation, you all understand. Existing comorbidities. Now, many of them suffer from one or the other comorbidity. It could be in the form of whatever. It could be affecting their breathing, or it could be affecting their gait. So these are there which can affect. Then issues arising out of economic difficulties at home, emotional outrage which may happen at home, and most of it, they don't understand what is happening. They don't know what to do. So what they need to do and what we need to do for them. Explain corona and its doing without alarming them. Rather, reassuring them that, look, corona is there. This is what is corona. This is what is lockdown. This is what is hospitalization, testing. This is the way they are testing. We can show them photographs in TV, videos. This is what the death is all about, separation, why the shops are closed, why the non-veg is not available. If we explain them, and if we explain them again and again, every one of them will understand. Only thing is, we need not explain them in abstraction because they do not understand abstraction. They need to be explained with pictures, images of all the above things which I mentioned. And plenty of them are available today, both in the TVs as well as in the WhatsApp. The second and the equally important is fill up routine with their some interesting things, which also attracts a lot of appreciation, not from the primary caregiver, but also from the other family members. Mopping, dusting, cleaning, arranging, tidying up, helping in kitchen, connecting with family. Now, these are all things where they can lend a helping hand. Okay, even if they are not doing it 100% right or even 50% right, doesn't matter. He is learning it and you are also being helped. This makes a lot of difference for them, because once they are at home, they need to be involved. And lastly, forming a new routine with consistency, persistency, and praise. Why I say consistency? Because our children would learn after a lot of effort what normal person, or I would say a person would learn in, let's say, one day. He may take 5 days, he may take 1 month, but consistency will pay. Persistency is when you persist, even if he's not doing the mopping properly, you still let him do the mopping. Don't go and start doing the mopping for him. So such persistency will really help them. So again, now what all activities we can involve them in this? Walking in home. Now they cannot walk outside, and most of them have been used to taking some walk in the morning or in the evening. Yoga, TV, music, DVDs, artwork. They are very, very interested in artwork, painting, and such things. Mobile games, group watching, telephoning friends, especially the higher functioning persons. They like to telephone. Other day, Mr. Bode of Parivar was telling me that his son is on the phone for almost 3 to 4 hours a day. Then video calls, albums. They will like to see old albums, old incidences, the familiar faces, and YouTube. Now, again, I repeat, it costs ₹0 to respect your person with disability. And it costs nothing if you appreciate him. And these are two things which will make great difference for you as well as for person with intellectual disability. So now we come to family and caregiver, the next ring which is formed around persons with intellectual disability. The most important, which we all need to understand, is that well-being of person with intellectual disability is dependent on well-being of caregiver. Nobody knows better than the mothers, but then all of them ignore their health at the cost of well-being of everybody else. So primary caregiver mother is overloaded due to non-availability of external help in well-to-do families. The same mothers are also exhausted in not so well-to-do families because they still have to make ends meet in those trying circumstances. So either way, they are under pressure and they could be under irritation or they could even have a little short temper. Now, lack of space can result in stress in the family members. If 5 of us are sitting in one room, I'm talking about many Mumbai slums where we serve from AWMH. It is a very stressful situation both for adults and children. Sharing of resources. Now, when you are sitting in one room and there is one TV, then again, it can cause a lot of stress among the members. Economic stress and unemployment can manifest in different issues, including violence at home, which is becoming more and more common now. Then hygiene and sanitation may suffer. Now, here again, I am using the only mantra here is stop trying to calm the storm. Calm yourself and the storm will pass. Let's see what we can do, what the family and caregivers can do to make themselves as comfortable, as persistent as possible. Get connected and network with relatives and friends to share your mental burden. They always say कि यदि आप अपना दुख थोड़ा सा बांट लेंगे तो फिर दुख उतना नहीं रहेगा. So it's very important. Form neighborhood pressure groups to get support from local government. This is especially so for persons with disabilities, such families which are living in slums or who are dependent on their rations from the government at this stage. They need to form a pressure group. They need not get only rations. They need to get soap, oil. There are many things, and phenyl, Dettol. All these things need to be supplied by the local government. So again, form a small pressure groups. Network with special school, workshop, parent group to share status of person with ID. Now, one thing what has been seen very effective is that when the school or the workshop sends a video, the person with intellectual disability is highly interested. To give you an example, yesterday we received a video from Pratna where my son Abhay, he goes there. And he was glued to that video for next 1 hour. If there is a time, I'll show you that video. Now, it's always said that what parents say, you may say 10 times, he may listen once. But when the teacher tells him on the video, he will listen straight away. So that networking is very essential. Never hesitate to take counseling support from for person with ID, self or family members. Confidentiality is maintained. Now, this is another, in our country, taking counseling support is considered as a stigma. क्या हो गया उसको? क्या हो गया? Psyche हो गया. Like all these things are said. But here, within the 4 walls of your house, take counseling support. And there are many numbers of very good counselors who have come forward, giving their support. पूरा फ्री में आपको सपोर्ट मिलता है. My next speaker, Professor Kolhe, her Tata Institute of Social Sciences, they are running a counseling helpline and very good helpline. So such supports are available. Take it whenever you feel like and have no hesitation. When approaching dire economic state, call out to NGOs. There are many NGOs today in the field who are supporting with medicines, groceries, tele healthcare services. In सबको आप use कर सकते हैं. Now what I am trying to tell here the parents is not only you, but you will be in contact with 100 other parents. So please give them this message to the families and the caregivers that the services are available. They need to contact those services and get the services. Standby plan for isolation, quarantine and hospitalization. A very important thing, mostly ignored by the family. What will happen when you and your partner, father and mother, both go for isolation, who will take care of your child? Or if your child has to go for isolation, who among you will go there and stay with him? Or in quarantine, who will go and stay with him? So such things, please work it out. When the incidents occurs, you may not have so much time to react. Similarly for the hospitalization. So again, it is again calmly think and plan ahead. Networking is something which is going to be very useful at this point of time. So for persons with ID and family and caregivers, my conclusion is persons with, they require reassurance at every step. If you are explaining them what is corona, please also explain them that it is one of those flus which happen when you, last time when you got flu, fever and some cough and cold, that is what is the corona all about. Change needs to be explained. They need to be told why their routine is being changed. Respect, appreciation, we have talked about it enough. Now, what we also found out from our experience is that low functioning persons, both intellectual disability and autism, tend to adjust more amicably. What we have seen is low, in fact, it is contrary to what we always thought. The low functioning persons are very well getting adjusted, but the higher functioning persons are the ones who are requiring more support. So for higher functioning person, I strongly suggest take outside family support, whether it is his teacher or her friend or some counselor or a relative. Let them speak to her and she will understand. Again, same thing, word from familiar, school teacher and workshop is very, very effective. Do not hesitate when antidepressant drugs under prescription are to be given. Now, especially we have seen few cases in high functioning cases where the person is becoming depression. They are going into the depression or they are even becoming little violent. So in such cases, don't hesitate. Don't think that they will get used to it. They will come out of it. Watch for signs of fear, depression, behavior issues, and take expert help. Let it not go out of hand. We are all in lockdown state. In a small house, such things can aggravate many other situations. And lastly, I'm saying parent volunteers and telephone advice is also available. Avail that advice. For 3, 4, and 4, 5, these are empirical observations. I will request NIPID. They can do further survey and research, and it will be very helpful for the parents because it is contrary to what we always thought that the higher functioning person will adjust faster and the lower functioning may take little more time. So here again I repeat, जिन्हें हम वक्त देते हैं वह हमारी कदर नहीं करते, जो हमारी कद्र करते हैं उन्हें समय पर वक्त नहीं देते. So please give quality time to your person with intellectual disability. It will pay off very rich dividends. Now I go to the community. This is the next ring of fencing which has happened. So here first comes the hospital. Now, there are many instructions which have flown from Ministry of Social Justice and Empowerment, Ministry of Home Affairs, Ministry of Health and Family Welfare. So all ministries are sending instructions, but what finally has reached the hospital, we really don't know. There are some hospitals who have got the instructions, there are some hospitals who don't have, but we have seen most of the hospitals, at least those who are not totally packed and filled, they are quite sensitive to person with intellectual disability or person with disabilities requirements. Only you have to tell them that, look, this is what he should get it. So priority test of PW, person with disability, and preferably at one place. Barrier-free washing areas. Assistive devices will be sanitized. So if he is using an assistive device, especially for with physical disability, or even those who are wearing specs, anything, whichever is an assistive device, it will also be sanitized and given back to him. Caregiver of PWDs are allowed to reach them by being exempt. This is very important for persons with autism or with intellectual disability. You are always allowed. You may have to put PP suit, or you may have to put masks, special masks and all, but you will be allowed to be with your son or daughter. No medical bias of any kind. There should not be any bias when it comes to ventilator or access to intensive care. We hope such eventuality doesn't arise, but there cannot be any bias for persons with intellectual disability. Continued supply and access to medicine or supportive medical aid. This means if the person requires other medicines for his psychological need or for whatever need, that should also be provided in the hospital. Hospital management should conduct training and awareness among health workers to prevent prejudice and bias against persons with disabilities. Now, this is their instruction, how much time they have to conduct such training. But yes, from Parivar, we have volunteers which go to the hospital, make them aware that this is what you have to do when any person with disability comes. Closely consult and actively involve civil society organization in framing a right-based policies. Now let's see the ward or block health officer and the local police. Now these are the persons who will come first in your contact whenever any eventuality arises. That's why I'm putting them here separately. Again, the block health officer will guide you for the testing, and he should know or he should be told that PWDs get priority in getting tested, and that too tested at one place. Many places you'll find there will be long queue for getting swab test done, but they should get a preference there. Then arrangement of ambulance. We are all entitled for a free ambulance. Of course, every citizen is entitled, but if you talk to the block health officer, tell him that, look, I have a person with disability, he will arrange an ambulance on priority for you. Priority in issue of access passes to caregivers. Priority for home-based isolation or quarantine when feasible. Now, this was earlier. Now, the government has given instruction to all the health authorities that as far as possible, persons and the families can have their affected person in isolation at home or even quarantine them at home. So, let's do it as much as possible. Barrier-free washing area in the hospitals or wherever, even in an isolation area, if it's kept outside the house, that washing area has to be barrier-free. Of course, it may not require so much for a person with intellectual disability or with autism. Closely consult and actively involve civil society organization. They have been told that whatever they need to know about persons with disability, they can contact civil society organization. That means the NGOs who are working in this sector. COVID-19 assistance fund being granted to PWDs for medicine. Many district authorities are using these funds. This is being granted to them by the state government, comes through the central government. Now, this fund should also be used for the medicine if the medicine is not available in the hospital for person with disability. And peer support network to facilitate support during quarantine. Now, again, some states I know they are attempting, I would say rather some districts they are attempting, but this is what we need to bring up the support, peer support. Again, when it comes to community care, we consider Parivar, state federations and our members, 300 members, we are all part of the community. So what are we doing? We are arranging emergency relief, medicines, groceries, wherever possible. We are also networking with many other civil society organizations to provide supplies. Naturally, Parivar doesn't have reach everywhere, but we do have reach in many places. We do know many other civil society organizations who are doing a great work in distributing groceries. So let us know and we will direct them to you. Then spreading awareness among the parents on do's and don'ts. Now this is what one of our main tasks. We need to tell parents, and parents need to spread it further. Like today, what we have come to know here, please do spread it. I will even share my presentation with everyone. Advocate with central state government to fulfill their commitments. We'll see they have got huge number of commitments, but most of these commitments are not fully fulfilled. They also possibly try, but crying babies get more milk. This is the state here. So we need to keep advocating with the governments. Advocate for individual cases needing service from local government. Because the services at the end of the day going to be provided by the local government and not by the central government or by the state. So we need to have some individual cases if they require any services. The parivar member, vocal member need to go and talk to the corporator or to whosoever is there, like a health official member, and get those services to the needy person. Members operate helpline. Some of our members are also operating helpline and counseling services. Member generate awareness among the communities. Now, what is this community awareness? Collective response towards precaution against spread of COVID-19. Now, this is also being spread through various TV channels, various shows and all. But then communities also have a helping hand in contact tracing and self-isolation. Similarly, they also become pressure groups against defaulters, and the communities also form networking for support. Basically, the community role is to facilitate what we need to get it and also facilitate that we all remain safe within that community. Now let's come to the government part. Now, what we are asking from the government is all what is given to us by the Rights for Person with Disability Act. So this is not something which the government doesn't know. Most of us, of course, do not know about it. The first and foremost is support during natural or man-made disasters and follow up on provisions of Section 24(3) of Right for Persons with Disability Act. The act itself says that whenever there is a man-made or natural disaster, we need to be taken care. Then priority in attendance, treatment and healthcare in hospitals. This is also there in the act. Ensure 5% reservation in Nariga schemes. Now, today the government is flowing almost 1 lakh crore, in fact 1.25 lakh crore in Mahatma Gandhi National Rural Employment Guarantee Schemes. Now, the person with disability need to get employed there, whether it is with intellectual disability, whether it is with any other disability, they need to get soft jobs there. And this is all there in the statute. Only then they will be able to earn some money for themselves and for their families. 100 days is being guaranteed by the Prime Minister's scheme. Then barrier-free access in all parts of government and including private hospitals. Now, this is again given to us by the Act. Caregiver allowance to persons with high support needs should also be there, and ensure essential medical facilities for life-saving emergency treatment. So all the ICUs, CCUs and ventilators, everything comes under emergency medical treatment, life-saving medical treatment. And this is guaranteed to us by Section 25(2)(j) of Rights of Person with Disability Act. We need to know this to be able to tell a hospital, to be able to tell a councillor, to be able to tell a MLA, MP, minister and everyone that this is what we need to get it as a right. So I'll sum up here. Respect, appreciation and consistency to support. We discussed about it. Innovate and prepare a homebound plan involving household work. Primary caregiver takes special care of herself to remain fit and mentally strong. This is very, very important. Now, again here I also said that we need to also involve some teachers, friends, because when they talk, when they get involved, it becomes more effective for the child and it also becomes better for the parent. I like to show a small video here, how we are doing it from AWMH. In AWMH Maharashtra, we believe that the children should also get some company because today they are feeling without company at home. So I'll show you a video where technology is being used. I'll show you another video. Here is carrying out little bit of therapy. See, the child is responding so happily. And now I'll show you the Prayatna video where my son goes and
सबसे और अपने घरों में आज मैं आपके साथ देश दुनिया की खबरें शेयर कर आपके आसपास क्या चल रहा है। पिछली 14 जुलाई से आने वाली 24 जुलाई तक हमारे मुल्क में लॉकडाउन फिर से ये लॉकडाउन के बाद हमें अपने घरों में रहना और लॉकडाउन क्यों हुआ है इन कोरोना के केसेस बहुत ज्यादा इनसे बचने का ये सबसे अच्छा आपको स्प्रे में बेसिक स्टे सेफ मतलब आपके घरों में रहिए और सुरक्षित अगर आप किसी कारण से बहुत जरूरी जाना पड़ रहा है बिना जाए आप नहीं चल रहा है तो आप ये चीजों का ध्यान रखना है आपको एक राइट दूसरा देखिए और अपने बैग में या पॉकेट में ये सैनिटाइजर जिससे आप साफ कर सकते हैं और घर आने के बाद अगर आप नहीं भी है तो कुछ
so this was Krishna Pant madam from Prayatna, and so at the end I will go back to my favorite theme where I say mindset is what separates the best from the rest. And let me play out a small video here for you from one of the mother who stays in my building, and she's just about 2 floors away from my house. Look at that mother.
Parents Dr. Riti Vaishali. I work as a medical officer in Pune Municipal Corporation, and now I'm in charge of 500-bedded center which have all COVID positive patients. I'm on a very special child. He has autism. He's not vocal. But along with that, I'm dealing with being a doctor and a mother and how stressful it has become since 3 months now since the pandemic of COVID-19 has happened. Most of the times I'm outside the house 24/7. We are working in the center. And life is become very tough. I mean, we have isolated ourselves. It's a conscious decision so that we don't need caregivers. 24 hours we are coming in contact with all the positive patients. So the fear of transferring the infection to our family and children, we have made the choice not to. But it's very difficult staying away from a child for such a long time, not able to take him in the arms, not able to love him. Even if I do, what am I? That fear in my heart that, oh my God, what if I know get him the infection? So I just phone the house and he sees that I'm dead. But he sees saying that I'm not taking him here. Okay. So I take a bath after doing all my rituals. That's what we do. If we're coming home from the hospital, I take a bath. And then after that, he comes near me, tries to me, and tell me that I'm missing you. I can't speak, but his body language and everything, the smile on his face, I can understand he's missing me. But I have no other option. So that's a bit emotionally very draining because I'm not able to take care of a child. It's, I feel a bit guilty, but then I have this responsibility of taking care of my patients. Luckily, I have a very loving and caring, understanding husband who is taking care of my child. And my parents are now. They are also contributing their bits of taking care of me, everything. And since the schools are not now, there are no therapy classes going on. So the children are getting bored and staying at home for such a long time. I think since 3 4 months they are locked down in the house. I would just like to suggest that let them play in the house, try to contribute your participation by playing things, simple things. Yeah. Let them do some paintings. Let them see how you all these small things just help let your children concentrate for some time.
So that was Dr. Preeti, the brave mother. I will leave you here. Thank you all for listening to me. And together we should face any eventuality, whether it is corona or anything else. We parents are strong and will remain strong. Thank you.
Thank you so much, Commander Bijur sir, for your presentation. It was indeed very enlightening to know the different roles that parents organization and the federation is playing at the community level, and at the same time at the with the government, in collaboration with the government. Thank you so much. Now we'll go for our next presentation. Our next speaker is Dr. Vaishali Kolhe. She is Associate Professor at Center for Disability Studies and Action, School of Social Work, Project Director, I Access Rights Mission, at Tata Institute of Social Sciences, Mumbai. She has completed PhD in speech disability. She was a former chairperson of the Center of Disability Studies and Action, School of Social Work at Tata Institute of Social Sciences, Mumbai. And she joined as assistant professor in Department of Medical and Psychiatric Social Work in June 2002 and joined Center for Disability Studies and Action in June 2006. She is primarily engaged in teaching, training, research, audits, and consultation in the field of rehabilitation and disability inclusion in health, mental health, early intervention, inclusive higher education, skill development, and accessibility. She is currently engaged in two field uh, actions research initiatives with participatory research methodology and disability inclusion programs at universities in India. In 2003 to 2005, she actively engaged and worked with mental health issues of child laborers in Dharavi and their skill-based empowerment. 2004, she worked with TIS's T-Tsunami disaster relief activities at Kadlur district with coastal villages on needs assessment and trauma counseling for crisis intervention and rapid assessment during disaster. She has presented various papers on national and international conferences. One of the paper on restructuring the new legislation for persons with disabilities by implementing the UNCRPD framework in Indian context were presented at conference. Education for all uh, was presented at conference Education for All, University of Warsaw, Poland, 2011. She had been to University of Gothenburg, Sweden as faculty exchange program for teaching and collaborations during April 2011. In 2011 to 13, she headed research project on micro-level planning of disability in M-Ward to develop People's Development Plan for Disability with CBR and is now developed an early intervention center in collaboration with another NGO, a free therapeutic rehabilitation center to 50 children with disability. A field-based awareness program organized on Disability Railway Project, Mumbai Local Merijan, from where students were engaged in street play, theatre, and exhibition for creating awareness, and disability sensitization program for railway authorities and public commuters, 2013. She is also instrumental in initiating first field action project I-Access Rights Mission, TIS's initiative for inclusion and accessibility at the Center for Disability Studies and Action on issues of students with disabilities in higher education and accessibility issues, which has developed two government regulation on teaching, learning, or exams of 21 types of disability and making universities with implement barrier-free environment. She is currently teaching subject disability, human rights, social policies and laws, rehabilitation context of persons with disability, involves lifespan approach, sustainable development goals, livelihood framework, and facilitation organization of job fairs with NASIO as part of fieldwork activities since last 5 years for youth with disabilities. She is a member of Sexual Harassment Committee, member of various corporates and Mantralaya. She is member of CII Task Force from TISS. She is a state advisory board member as disability inclusion expert appointment by Government of Maharashtra. In 2016, 17 and 18, she has organized National Conference on Disability, Accessibility, Inclusion and Well-being at TISS initiative to create a platform for all the professionals to dialogue on emerging issues in context of RPWD Act 2016 and legal and policy practices and bring best practices in the country on disability inclusion innovation, inviting WHO and UN representatives. I welcome Dr. Vaishali Kolhe ma'am. Ma'am, next mic is to you. Isolation and quarantine of persons with disabilities. What are the challenges and guidelines? That is what is our theme, and the content would be introduction, why there is a need to talk about isolation and quarantine of PWDs. Of course, this part, much of it is already covered by Commander Srirang Bijur sir. What are the existing guidelines that we'll be summarizing? What are the challenges and what is required? What should be the way further? Yeah. Hello. Yeah. Now, what is isolation? It is to separate an individual who are ill and suspected or confirmed of COVID-19. Quarantine is a separation of individuals who are not yet ill but have been exposed to COVID-19 and therefore have potential to become ill. So, NIPID had already started telecounseling services for people with disabilities and their family members, and various concerns were shared with us. Among that, two major concerns were like, what if our child with disability gets COVID-19 infection? What should be done? And what if we, the primary caretaker of CWDs, get COVID-19 infection and have to go for quarantine or isolation? What will happen to our children with disabilities? So just to understand, so I tried to I was not really having a ready answer to this, so I tried to understand what is isolation and quarantine and what are the provisions in this context for people with disabilities. And the first question when I was talking to different stakeholders was like, is there really any person with intellectual and developmental disabilities who has to undergone isolation or quarantine till date? And many of the doctors and hospital staff, they said, till date we didn't receive any such case. So I also tried to go if there is any official data and authoritative data, a data from an authenticated data or from an official source talking about COVID-19 infection incidences in people with disabilities. And I did not really find any official data. So I had just to calculate it. It is a very basic mathematical calculation. So the total population of India, 121 crore as per 2011 uh, uh, this thing, census. Total persons with disabilities were around 2.68 crore, which is 2.21%. Total COVID-19 cases confirmed in India as given on WHO website is 11,18,043. And there was, I didn't get data on asymptomatic cases. So it is yet a hidden population of that is asymptomatic cases. So if we just make a mathematical calculation, the probability of PWDs with COVID-19 infection goes up to 22,000 to 24,000. And it's a number, it's not a small number. I understand that the incidence and prevalence is not scientifically calculated in this way, and there are even other dimensions to understand it, but because I couldn't find any official data on incidence of COVID-19 infection in PWDs, I need to understand that the question that parents were asking to me, was it just a fear or anxiety of the parents, or could it really happen? And if at all it could happen, what could be the population for whom we need to think of? So, what did I do? I reviewed the existing guidelines given by WHO, guidelines given by ILO, UN, guidelines given by Government of India. So I reviewed the existing guidelines. I had telephonic discussions with medical professionals, the doctors who are providing services at COVID care centers, community medicine experts, and psychiatrists. I had focus group discussion with parents of CWDs, and I'm very thankful to Commander Bijur sir for getting me connected to different parents and representatives of various parent associations. These were the representatives of parent association. I had a focus group discussion with rehabilitation psychologists and few more telephonic conversations with other experts like people who are giving consultation to government in establishing the COVID care centers. And finally I did a qualitative analysis of the information that I got. And I must say, I am very clear that this is an initial step that has been taken to understand a very basic step, an initial step that has been taken to understand uh, what exactly the scenario of isolation and quarantine of people with disability is. So, what I realized is during the discussion that yes, persons with disabilities, they are at high risk of infection, not because of the disability, but because of the other comorbid conditions. Then there are also associated behavioral problems or sensory problems or lack of self-help skills in PWDs, uh, which may even lead to some barriers while giving treatment for PWDs in isolation or quarantine. Emotional dependence of persons with disability on limited family members and on their own house. The other psychosocial factors are discrimination, either gender based or discrimination due to disability, the possibility of abuse and violence. And it has been reported in few areas that the abuse has been increased. Neglect, as it is a minority group and it is considered as non-productive, yet that attitude is there in a larger community, so that there is a possibility of neglect towards the needs of people with disabilities. The access to information and health services is made mandatory as per UNCRPD, and even in the guidelines it has been mentioned. But on ground, the limitations were found. Ease of access to the concerned authority was a major concern shared by the parent representatives. And during the lockdown, there was limited transportation. So to reach out to the required service centers was a difficulty. So during all these focus group discussions and telephonic conversation, most of the stakeholders come to the common agreement that PWDs have different needs for which additional attention and preparedness is required. Various stakeholders agree that specific guidelines are required for isolation and quarantine of PWDs. The guidelines should be disability specific, and every state may have separate plan of action because the geographical, the cultural differences are there in India in state wise. So a separate plan of action might be required. Guidelines not only for state and system, but also for community members at large are required. Along with guidelines, micro planning and action plan is also required. But while saying so, does it mean that guidelines are not there? Or does it mean that guidelines do not mention anything about PWDs or isolation of PWDs? That is not really so. But there are the guidelines which we found were required to be prepared more specific, uh, targeting the needs of people with disabilities. So the existing guidelines, World Health Organization has given number of guidelines for state, guidelines for the country preparedness, guideline for city preparedness, guidelines for hospitals, guidelines for all different kind of stakeholders. So I have not really introduced all the guidelines given by WHO here, but I have just named few. One, disability consideration during the COVID-19 outbreak. They have considered disability specific issues, and action plan for various stakeholders are given in this particular guideline. For example, action plan for community worker, that is also being given. Action plan for organizations, that is also being given. So I really um, felt that yes, something is mentioned in this guideline. There are guidelines on operational planning guidance to support country preparedness and response. So, what a central government should do, what a state government should do, how a country can be prepared. So, these guidelines are mentioned in this document. Practical action in cities to strengthen preparedness for the COVID-19 pandemic and beyond is given by WHO. There are also guidance for school and workplace and institutions. Next are guidelines given by ILO, International Labour Organization, COVID-19 and the world of work, ensuring the inclusion of persons with disabilities at all stages of the response. And they have specifically mentioned about occupational safety and health and continue PWD's occupational growth. Now, saying this, and even in the guidelines given by Government of India, it has been mentioned that persons with disabilities should be considered if at all they want to work from home, and so that they can continue giving their services, they can continue with their job. Further micro planning is still required in this area. No one left behind, not now, not never. Promote equality, ensure labor right, provision of social protection is there given by International Labor Organization. COVID-19 response, considerations for children and adults with disabilities. It talks more about preventive aspects and risk reduction, which is given by UNICEF. So, even in the earlier documents, what I could see is the more emphasis was given on the preventive measures, prevention of people with disabilities from COVID-19 infection. And these are few guidelines given by Government of India. Hold on, please. Yes, sir. I'll, slide. The, oh, so, yeah, just a minute. Yeah, can you see it now? Existing guidelines. Yes, sir. Yeah. Yeah. So, can you see the slide, existing guidelines now? If someone can help me.
Yes, ma'am.
Yes, we
Yeah.
can see the slide.
Yeah, thank
But
you. Thank you.
put it on
So,
slide mode.
yeah, thank you. So, the existing guidelines, I was talking about the guidelines given by Government of India now. One is on home quarantine in case of travel agency, travel history. This was given sometime in March of this year. And so these guidelines talk about, in general, if anyone has a travel history, what steps to be taken in home quarantine. But it does not specifically talk about the cases of persons with disabilities. So additional recommendation needs to be added. Next is COVID-19 outbreak guidelines for setting up isolation facility and ward. And I really like this document in the sense that all the details are given, checklist is provided there, like how the hospital should be ready, how the hospital staff should be prepared, whether the staff is being trained in dealing with COVID-19 cases, or so all details were given, how the patient, COVID-19 positive patient, will be transferred from one unit to the other unit, how the lift will be prepared. So all such kind of guidelines are given in this document. But unfortunately, there was not a single point mentioned about the preparedness of the hospital setup or center to help persons with disabilities with infected with COVID-19. So this is the area where probably we need to step in, and some additional guidelines or additional action plan can be given, specifically looking after the needs of persons with disabilities. This might be added in this. Then there are national guidelines for infection prevention and controlling healthcare facilities. And again, as I said, when it comes to preventive measures, there are a number of guidelines given. Some also mention about preventive measures for people with disabilities, but yet a micro planning and action plan is required. Even recently, NIMHANS has also given a guideline, uh, and that there they have mentioned few disability specific pointers if at all persons with disability get infected with COVID-19. Yeah. So next is enabling delivery of essential health services during COVID-19 outbreak guidance note. It is given by Ministry of Health, Family Welfare, Government of India. Definition of essential services is given. Facility mapping and planning is mentioned. Telehealth, mobile units has been mentioned, and role of ASHA workers and web-based platform for training is considered in this. Now we also need, while saying this, we also need to consider what about people who are not yet having net access. Could reach out to those people, or the telemedicine, how that can be made accessible for people who are living in remote and rural areas. That is a component which we need to work on. Then there are guidelines for for home isolation of uh, home isolation of very mild or pre-symptomatic COVID-19 cases. There are detailed instructions given about how to wear mask, which type of mask should be wear. But again, disability specific action plan is required. And by Department of Empowerment of Persons with Disability, Ministry of Social Justice and Empowerment, Government of India, there is a guideline called Disability Inclusive Guidelines, which specifically mentions that information should be made accessible. There has to be provision for essential services. And they have also mentioned about mechanism to resolve disability specific issues at state and district level. Again comes the questions, once the mechanism is up to district level, how that can be connected at the grassroots level at the rural and remote area. Now, so just to summarize, preventive measures, yeah, there are guidelines, and implementation may be challenges due to disabling conditions. So maybe some action plans, some training modules might be required. Hospital or COVID care center preparedness, there are guidelines for that, but need disability specific points to be included. Preparedness of cities and larger communities, guidelines are there, for which micro planning is required. Information dissemination needs to be taken care, and involvement of various stakeholders, including self advocates, should be considered. Social audit is required, and where inclusive action plan should be considered. Development of social support is also a point to be included and requires action plan, and preparedness of stakeholders, for which development of training module is required. Now, for doing this, what could be the challenges? If at all, as a professional, I want to do it, what would be the challenges? One is lack of data on incidence of COVID-19 infection among the persons with disabilities. When I talked to a few doctors and few parent organization representatives, I came to know there are cases of persons with disabilities and have got COVID-19 infection, or because their family members have got COVID-19 infection, they are either have to go for quarantine. But I did not, as I mentioned earlier, I could not get an authentic official data on this. Poor awareness about the existing guidelines. Yes, this is there, though the guidelines are available on all the websites, government websites, and on different international platforms. But still, those are uh, segregated. So it is nothing is at a one platform, and then on different points, the guidelines are at different platforms. So because of that could be one reason. Another reason could be that everyone may not have access to the internet. So poor awareness and poor accessibility to these existing guidelines is there. Generalized action plan for implementation of existing guidelines. Yes, there are generalized action plans for a larger population in general. Bare minimum mention about PWDs. Biomedical waste management in cases of home quarantine. Yes, there are certain instructions like how to wrap the used personal protection equipments and how to put it in the dustbin. But what from the dustbin to the dumping area or how it will be disposed of? That needs to be, some guidelines are required in that area. COVID-19 in other areas affected by natural calamities or disaster. We have an example of Assam flood recently. Before that, Amphan cyclone in Odisha and West Bengal was there. So when such natural calamities and disasters are there, what to be done? So we need to have some action plan and guidelines in this area. The role of various stakeholders is not yet identified, leading to uneven burden of work. The medical professionals are overburdened. The paramedical professionals like nurses, they are overburdened. Whereas probably for awareness, for information dissemination, for social edits, other stakeholders can be taken into consideration, which is not yet seen very actively at all levels. The task force include medical doctors from administrative staff at large. Other rehabilitation professionals do not seem to be a part of the task force. For example, if there is a case at a PHC and if they need any technical guidance, they talk to the task force at a district level, which are majorly doctors and administrative staff. And we need to consider that for persons with disabilities, in COVID-19 pandemic situation, it is a biopsychosocial impact. So the efforts needs to be taken not only in the medical perspective, but even in the psychosocial perspective. So what is required? First thing, measurement is management. So we need to maintain the data of incidence of COVID-19 infection among persons with disabilities, and we have to share it with different stakeholders. At least the policy makers and different NIs can be involved, and organizations like Parivar can be involved. And this data needs to be both quantitative and qualitative. We need to spread awareness about existing updated guidelines the earliest possible. So this webinar is just one attempt to spread this awareness, and more awareness programs has to be prepared or organized. We need to have exclusive guidelines for isolation and prevention of persons with disabilities. Action plan for implementation of those guidelines is required. Risk communication and community engagement has to be there. Involvement of various stakeholders, including medical professionals, paramedical professionals, rehabilitation professionals, community workers, volunteers, disability organizations, parent organizations, and self-advocates must be there in information dissemination, planning, implementation of the guidelines, and monitoring whether the implementation of guidelines is happening up to the mark or not. Ensuring the prevention of neglect, abuse, and violence. There are guidelines for this. Its implementation, appropriate implementations needs to be ensured. Ensuring access to health service. As I said, there is a mechanism from state to district. What next? How will that be made accessible? Ensuring financial support during this period. The point is mentioned in few of the guidelines, but we need to have a action plan how that financial support will be provided. Who will be doing that? Who will be looking after that? How the target group or the people at grassroots level will be connected with this scheme or this financial support. Development of training material for parents, for caregivers, for volunteers, and all other stakeholders. And this training would be of different needs, like how to take care of persons with disability if the person get COVID infection, how to prevent oneself while taking care of COVID-19 infection. Um, what are the preventive measures, which is now there are so many videos already circulating on social media, but we need to consider people with disabilities in mind, their specific needs, and maybe accordingly some videos or other material can be prepared and can be disseminated, can be given. We also need to have training for volunteers or other social support groups regarding, if in case of a primary caregiver of persons with disability has to go for isolation, how to give support to the person with disability back at home, what can be done, what precautions to be taken, how to prevent the person from neglect and abuse, how an appropriate care has to be taken, what about their medicines, and even training to parents regarding what preparation has to be made by them considering the probability of isolation or quarantine. So, small things like preparing documents of the person with disability, mentioning their initial condition, their requirements, their needs, their medications, their associated conditions, maybe a list of doctors from whom they are being seeking treatment. So, some such preliminary preparation has to be done by parents, and maybe a small trainings and training material can be designed. Training of the grassroots level stakeholders like community workers, ASHA workers, Anganwadi workers, volunteers has to be done. Involvement of behavior experts in changing community health related behavior. This is very important because I see many people around us, they come to market, the wearing of mask is not appropriate. Many people are sneezing without using a proper cough etiquettes. Why this is happening? Is it only because the uh, information is not available? No, that is not the only reason. Information is there, but still somewhere that health behavior needs to be inculcated in the community at large. So behavior experts may help in changing community health related behavior at large. Preparing rehabilitation professionals for future crisis situation. Indeed, we need to include component on disaster management in curriculum of all the disability rehabilitation specific courses. Development of social support network is very crucial. So when I was discussing with parent association representatives, and we were discussing about the national mental health helpline that is going to be launched, they said that even they can be involved where uh, when it is about a particular case in a particular location, maybe the parent organization can also collaborate and help the person to fulfill the needs. So such collaborative work is required from government organization, non-government organization, and disability organization. The collaborative and collective work needs to be done. The work is going on. There are awareness material being prepared. The ration and other required medicines and other things are being distributed among the needy population, but it's happening in bits and pieces. Now we need to make it more structured and we need to make it as a collective effort in a collaboration. So I'll stop here. These are my references. If you can just see, maybe I think you cannot see it. So I'll stop here. Thank you so much for your patience listening, and maybe we can have some. Yeah. So thank you. Thank you again. Mukesh sir, over to you.
Hello, can you hear me?
Yeah.
Yeah, actually, like we're trying to get the speaker Vaishali ma'am on board. Probably she's having little network issues. Probably we have to hold for a few minutes. Okay, so
Okay.
I request all the participants to just bear with us for another 2-3 minutes. We'll be coming on live very soon.
Okay. Mugesh sir, by the time Vaishali ma'am joins in, shall we have some questions, please?
Yeah, probably it appears like the next speaker will be needing little more time to get in. So meanwhile, I
Yeah,
suggested like I request the participants to just either ask your questions through audio
yeah.
mode, or you can type it in the
So
chat
there
box
are
also.
already questions. There are already few questions in the chat box. So one question is probably if Bijur sir, if you would like to answer. One question is how can we make children with severe disabilities understand about corona?
Hello, am I audible?
You are audible, sir.
Okay, okay. Now, children who are with high support need, now depends upon what kind of high support need they are. Some of them may be physical high support need, some of them may be intellectual high support need. But one thing is there are those who are not with intellectual disability but high support need. They need to be given instructions based on some videos and such things can be shown to them even if they are lying on the bed most of the time. But children who are high support need because of intellectual or autism, now such children again for them possibly it will have to be doing a role play by the parent or doing a kind of drama kind of showing some, they have to be given something more than just about pictures and all, that is need to be done with them.
Yeah. I would also like to add to what Bijur sir had said is when it comes to people with intellectual disability and when the severity is uh, more, uh, we need to understand that they may not be able to understand it even if we simplify the things on the first hand. What we can do is we can keep telling them, we can keep showing them, we can be the good role models for them. So the only thing I would say is let us not lose hope or let us not assume that they won't learn it. What we need to do is probably they may not be able to do it on themselves, but they may help you to remind that I need to wash my hands, you know. So because they will memorize to some extent. So we need to keep telling them. It would never be zero. It would be something. So that needs to be kept in mind. Thank you.
Shall I mute myself? Shall I? Hello? Hello? Can you hear me? Yeah, can you hear me?
Vaishali madam.
Yes, yes.
Yeah, and probably there is another request from Colonel Gautam sir. Here requesting ki can we I request all to give short
Hello?
mantras to accept and face challenges. Am I audible?
Yes, sir.
Yes, sir, you are audible. Yeah.
Yes.
Actually, like Colonel Gautam sir, he is actually thanked Commander Saab, and his message was, "I request all to give short mantras to accept and face challenges." Sir, Bijur sir, would you like to?
Yeah, no doubt about it. Absolutely no doubt about it. While we have to be prepared, we have to make our plan. What happens when one member of the family or person with intellectual disability, he or she goes into isolation or quarantine? Who will go with him? Mother will go, father will go, brother will go. Or similarly, if both the parents sought to get into quarantine, who will look after the child? All these issues need to be debated and discussed in the family, and they have to make a eventuality plan. Who is the relative who can support, or who is a friend, who is another parent who can support? Such things need to be worked it out by every family.
There are two questions. One is on who should be doing the social audit, and the other is on. So, about to answer this question, who should be doing the social audit? Through the discussion that I had with various stakeholders, it has to be a team, and one representative should be from the parent association or the person with disability. So, as a self advocate, so it is suggested. So the social and one person should be from the medical aspects, because isolation and quarantine, as I was saying, it is a biopsychosocial perspective we need to keep in mind. So
Hello, Kumar, and all organizers, Mr. Ravi, and all organizers who have contributed to organize this seminar today. So I'll begin with my presentation, and the title of my presentation is Isolation and Quarantine of Persons with Disability, Prospects and Challenges. When I analyze this particular topic, the three fundamental questions which comes to my mind and which I would like to ask all of you as professionals working in the field. The first fundamental question is, what is the existing governance mechanism for providing the services, COVID services and quarantine services for persons with disability? This is with special reference to isolation wards, emergency services, services related to ambulance, services related to medication, and different facilities of isolation. The second question is, what is the operational mechanism, in terms of, for example, if the information goes to collector office that this and this person with disability requires is COVID, and he requires a quarantine, this requires a quarantine and facilities related to that, then what happens there? So fundamentally, what is the operational mechanism when the information reaches to government authorities regarding persons with disability? So that is a fundamental question. Then third question is that how do we as professionals working in the field can strengthen the existing structure of COVID interventions? How do we bridge the gaps which are existing today, which is highlighted by Mr. Bijur, Commander Bijur, and also shared by in the question and answer session. So I would like to begin my presentation with my first slide in terms of the introducing. Can you go to the first slide, please? Yeah. In terms of the COVID outbreak and how the global crisis of COVID-19 is deepening in the pre-existing inequalities, exposing the extent of exclusion and highlighting that the work on disability inclusion is imperative. People with disabilities are 1 billion people in the world, and which are the most excluded group in our society and among the hardest hit population in the crisis in terms of different emergencies. This is said by the UN report, May 2020. So we need to have an integrated approach in order to ensure that people with disability are not left behind in the COVID scenario, and one needs to look at the to position persons with disability at the center in terms of providing response and participating as agents of intervention, planning and implementation. This is also said in the UN report, saying that how they are the most affected by these COVID scenario. We all know that the decision related to quarantine and isolation has to be decided based on the evidence which are available. So at the end of the day, when I look at the current scenario, I look at that what is the existing governance structure. If you look at any particular state government, the apex body is the disability commissioner, followed by the district collectorate, and then when it comes to district collectorate, what is the operational mechanism of governance over there in terms of providing various services? Largely, when I see the scenario, I can only just count on my fingertips that there are mental health telephonic services, There are different NGOs like Parivar and various other parent organizations and different NGOs which are advocating for the rights for persons with disability and taking their own initiative in terms of filling these gaps in the service delivery mechanism. Also, when I look at, there are different schools, volunteers who are coming forward, like NSS volunteers who are coming forward to provide the day-to-day services to persons with disability. Coming to my next slide is that, can you go to my next slide? Yeah, so fundamentally what we need to look at is mainstreaming of disability services in the COVID-19 response for the recovery, for all the targeted actions which we need to take up in terms of providing the need-based relief to the persons with disability. A combination of mainstreaming facilities and disability-specific measures are necessary to ensure systematic inclusion of persons with disability. And that is what is the core in terms of providing these services at a mainstream level. So which requires convergence of schemes, and every government should think about what are the provisions they are providing to the persons with disability. Professor Bijur, Commander Bijur just now mentioned about NREGA, that how the government has so much of fund, but they are not providing any kind of jobs to the persons with disability. Neither they have a database of how many persons with disability they have provided employment. Now, this is a larger scenario in terms of mainstreaming of job, but coming back to quarantine and isolation facilities. So all the hospitals should have facilities for persons with disability in terms of quarantine and isolation facilities. Plus, there should be a disability specific measure. Now, if I look at the scenario of persons with intellectual impairment, persons with autism, what are the different disability specific measures which are required in terms of in the hospitals as a general services, general health, public health services to persons with disability. Similarly, I look at that how we need to look at disability specific services in terms of ensuring accessibility of information in terms of braille and other ways, other mediums of accessible format services in a particular manner which is accessible to person with disability. Also, the facilities and services, all the programs and services has to be in the accessible format, which is for providing the relief to the person with disability. And the third, a very important point is the person with disability are the most hit population and most vulnerable population. And as we see as parents, as professionals, we see that they have the basic communication concerns. And fundamentally, how there are different levels of communication which they follow. So we need to use a language which they are easily able to understand and comprehend in order to get the services in a more accessible manner. Most of the studies which are done today shows that the negative psychological effect on the persons with disability, which is loaded with confusion, anger, stress, quarantine duration, infection, fears, frustration, boredom, and financial loss stigma, which is said by Brooks in a study which she has done on the psychological impact of on the persons with in the COVID scenario in 2020. Go to my next slide, please. Yeah. So as we all are experiencing lockdown at this point of time, and we all know what is happening in the lockdown situations, we are restricted in our movement, and we are developing into the new normal of social distancing. Isolation is becoming a new norm for our living, and we have to exist with this norm. We have to survive with this norm throughout, at least for a year or so. So what must be happening to all our children and persons with disabilities? And as rightly mentioned by Commander Bijur, that how the total restriction in the routine of an individual and how they are experiencing different levels of alterations in their lives, which they may not be, comfortable with. So, how the communication modalities are or also, they are not able to communicate to their near and dear ones, and there are restrictions in their daily routine. So, interventions are required in these lines in terms of restructuring their daily routines, and how we can make it more familiar to them, and more creative interventions with them using all kind of art forms, music, and different other forms in order to restructure their daily routines with a more comfortable, emotionally comfortable, and socially comfortable life in the limited resources what we have. And rightly mentioned by, again, in the last presentation, that parents, the only resource which are available to persons with disability are their parents and their near and dear relatives, who may be there with them, living with them, or on a distance. So how do we exercise the resource mobilization with these context of restructuring the daily routine? So at the end of the day, we need to have very creative kind of expressions and interventions in order to allow them to be part of the system. Effects of the lockdown basically shows a very negative picture, that how everyone is going through some or the other level of depression, some kind of a fear in terms of COVID infection, and also post-traumatic stress disorder if they experience violence and any other kind of scenario in their life. Also behavioral disorders in terms of not able to sustain their homeostasis in their mental and physical well-being. If they face, the Women Commission's report says that there is a high prevalence of domestic violence and child abuse. So imagine what is happening to our children with disability, and how they are surviving with this kind of a COVID-19 pandemic, and how it's impacting them with a high risk of anxiety, depression, and all kind of loneliness to them. So how do we basically work with this as all multidisciplinary professionals in order to design various interventions which are individual level, community level, and also at a policy level? Quarantine is necessary, become a very preventive measure of curbing out the disease from the current scenario. And we can't avoid the negative psychological effect of quarantine on individuals, which is again said by Brooks in 2020. And confinement to home is not the only solution, because we have no choice but to confine ourselves with the home quarantine resources, and whatever we have, we have to make the most of it. So which again, Commander Bijur said, it doesn't require money to really invest in terms of developing new kind of mindset to adapt to the new normal situation what we have today. So imagine how difficult it is for children with disabilities or adults with disability to deal with the different kind of these live different lifestyle where they are at home only, and if there is a COVID scenario, that how they face the negative environment on a very high degree and frequency in terms of impacting their mental health. So they are actually dealing with the dual disabilities. How the mental health is becoming a very important kind of, very important area of concern, because physical health, obviously it's being taken care, but their mental health, because they are non-verbal, sometimes they are verbal, but they're not able to express themselves fully. So how do we actually look at and keep their mental health positive? So rightly said that you show videos and show different kind of creative mechanisms to make engage them in a positive mental health, environment. So coming back to my next slide, let's look at what is quarantine and what is quickly, what is quarantine and how do we conceptualize the word quarantine in terms of persons with disabilities. So any person in the family having COVID and quarantine, just go to the next slide, please. Quarantine, that they are not ill, but they are, they are in a situation that they may be exposed to, some scenario of COVID-19. So they are potential to become ill. So how do we keep them into the quarantine scenario or quarantine homes? So when you say quarantine homes, they usually the voluntary, they live in their own homes, and home quarantine is being practiced by various professionals and advised also in terms of, because there are hardly services available at the general hospitals and COVID hospitals with special reference to person with disability. So the guideline on home quarantine, is available in the ministry's website in terms of, now this I've taken from the Health Ministry of Government of India, where they have shared, they have, you look at the paradox that, the government, the Health Ministry has developed the whole guideline of developing a quarantine center and isolation ward, but they have not even mentioned a word on disability in the entire manual. So how invisibility of persons with disability is very predominant. So basically what I mean to say that how persons with quarantine of persons with disability will lead to breakdown in the routine and severely affect their social and emotional life. And it may cause high level of stubbornness, helplessness in the families and parents in terms of dealing with this state of quarantine. Also prolonged, if it is prolonged, like 3 months are over now, then how it is aggravating towards their, behavioral issues in terms of anger, frustration, and other areas of disability. Go to my next slide, please. So in the quarantine facilities, what I suggest is basically all accessibility measures has to be taken. And also, as I said, that we need to look at if it is not home quarantine, and if we need to map out which are the quarantine centers in that particular government district, government scenario, and what is the various facilities which are there in the quarantine homes. Now, here in TISS also we have quarantine home where we have kept 100 people for quarantine. And when it comes to persons with disability, when you look at Mumbai scenario, that there are slums and hardly any place for quarantine. So when you, if I imagine a quarantine service for person with disability, he needs another person to be with him. He needs family and caregiver with him in order to be in the quarantine home. And we need to look at these measures in terms of restructuring their daily routine in that quarantine home, accessible washrooms and accessible different facilities, and hygiene facilities also in terms of using a mask, washing their hands on a regular basis, maintaining social distancing with other people, and making sure that they are not getting affected by it. So how these services are very important. The second important area is, so looking at, so if I look at persons with disability in the quarantine facilities, that it has to be accessible, it has to be mainstream wise accessible. Mainstream services should be given, which are given to everyone, and there should be a disability specific services which should be given in terms of information or the treatment, or treating them in terms of the daily routine, restructuring of daily routine in the quarantine home. and things like that, which can be only done by a person, a social worker, or a person who is known to the person by a caregiver, which are parents. The next is the isolation wards. The isolation refers to separation of individuals who are ill and suspected and confirmed as COVID-19. All suspect cases detected in the containment zone or buffer zone till a diagnosis is made will be hospitalized and kept in isolation in a designated facility till such time they are tested negative. So person testing positive for COVID-19 will remain in a hospitalized state. You know, so basically, what I mean to say that persons with disability in the isolation ward is a big question. That what are the guidelines for isolation of persons with disability? 1, 2 is how they are disability specific. 3 is what is the accessibility scenario in the isolation ward? Do they get treatment? Who give them treatment? What is the kind of interventions which are followed after the treatment? Also, the special isolation ward are required for persons with disability, and the caregiver services. The prime important question is who will caregive them, the parents or the mothers or any other a caregiver. Now, I would like to share a small experience of mine where a person with intellectual disability, adult with 18 years boy, who was diagnosed as COVID positive and was told by the government doctor to keep in isolation ward. So now they did not allow the mother to be there in the isolation ward, and this child was a non-verbal child and having all kind of other associated behavioral problems. Now this particular 18-year-old boy was not able to express himself that he wants the mother to be with him throughout the treatment. He was trying to communicate, but the doctors were not able to comprehend his speech and his communication. So the mother requested various times written letters and letters to everyone, but still they do not agree. Next day, this boy developed convulsions because he was separated by the mother and developed severe fear for treatment and non-responsive to the COVID treatment given by the doctors. And finally, he started vomiting. His condition becomes very, very critical. And at that stage, the hospital has no choice but to ask the mother to join in. But, and later on, the mother stayed with the boy for a week's time, and then slowly the boy got better and he was then further discharged. So the point I'm making over here is that the government doctors or the government machinery have no understanding that the caregiver is required for a person with intellectual disability or a person with disability wherever he is not able to do all his independent living areas with himself, and he is unable to take care of himself. So at the end of the day, what I want to say that social distancing is probably not made or not feasible for our children, and we are at risk of providing all services to them with all dignity, in order to give them a good quality life and future. And obviously, as parents, we are, and professionals, we are susceptible to all kind of risks, and we are able to take the risk also. But if the government officials, hospitals do not understand the concept of that kind of care become a human right of the child with disability who is having who is not able to live independently on his own in the quarantine period or isolation period. So this is the kind of guideline has to be developed by all of us by putting it down that what are the different facilities should be available at the hospitals for the isolation ward of child with disabilities, and what are the facilities should be available to all the at the district level for different facilities for person with disability. So this is what we need to right now. The mother was talking about in the last presentation. The mother was talking about her experience, and she was sharing her rich experience in terms of how she's taking care of the child, the person with disability. So what I mean to say that these kind of voices should be brought together under one platform, and maybe we all should create a dashboard in terms of, these are the interventions which are already happening in the homes, already happening in the families, but it's not coming to the government office or collectorate office or a service delivery mechanism where they will learn from the parents, they will learn from all these mothers who are taking care of their children so beautifully. So I think maybe Parivar or all you professionals, Keerti, you should think about how you basically collate all these interventions which are happening already in the field through all these videos, and and create a kind of a document and give it to the collectorate office and disability commissionerate, that these are the ways, different ways the parents have coped with the isolation and quarantine situations, and they have coped beautifully in terms of taking care of their own children. So the lessons are already being learned by these parents, and we should learn with open mind in order to include this as a very important interventions already happening in the field. So again, one of the gap I want to highlight over here is the interventions are happening at homes, but nobody is aware about it. The government is not aware about it. They just depend on the volunteers, NSS volunteers, or some kind of services which are being nominated by MLAs or political leaders, and for different other reasons. So what I want to suggest over here, that all the professionals sitting in this room today have to think and contribute equally as stakeholder in order to develop the COVID-19 interventions for persons with disability, in special reference to isolation and quarantine, and all kind of multi-sectoral services to them. And how do we really bridge this possible gap in terms of highlighting the interventions which are really required? I would like to give a very small example that, one of my friend, she is, my classmate of Ali Awarjung National Institute. She just shared a video on WhatsApp that her kids, who are 11 years old and 12 years old, girls, they are very good in music. Thus, they started this Music Beats COVID-19 group. And they said that we want to, collect funds for the food, for provision of food for children with disability in our area. And we just play our music and we donate, we ask for donation and we give the funds. So they targeted, so how children are keeping or learning new ways to help out, to reach out, to bridge this gap, to connect to the interventions, and contribute to the government and different other facilities. So and they targeted for around 5,000 some $5,000, and then they targeted to $20,000, and then they got $1 million in 1 month time, and they donated it to the government for the food. And the beauty of this is the children, with the value of respecting their own children who are living in slums and who are providing hello.
Ma'am? Vaishali ma'am? Yeah.
Yeah, can you hear me?
Yeah, yes ma'am. Yes ma'am.
Somebody called me and said you put yourself in mute, so I muted it. Yeah, so can I go ahead?
Ma'am, actually, please, your slides are not moving. So possibly if you can indicate your present slide number, we'll move to that.
Can you can't see my slide?
Yeah, that it is stuck in.
I can.
Yeah. Can you see my slide? Can I go ahead?
Yeah, please.
Yeah, ma'am, continue.
Yeah. So so basically how children at our own homes have thought about extending themselves to contribute to the persons with disability and their food and different kinds of arrangements and services which they lack. So coming back to the point is that how isolation isolation facilities for person with disability in a hospital or any center becomes a very, very prerequisite to provide the COVID services with reference to caregiver services and accessibility measures in living day-to-day life. So using music, creative kind of services and creative measures like art and play and different other ways. In fact, WhatsApp groups. Now the WhatsApp groups are doing wonders in terms of providing the interactions and various kinds of services to the person with disability. I just now shared this experiences only because of the WhatsApp group. So, how do we actually, yes, hello? Yeah.
Hello, ma'am? Hello?
Yeah. Hello? Yeah.
Yes, ma'am.
So can I? Yeah. Yeah. Okay. Shall I go ahead? Yeah. Mhm. Hello? Right.
Ma'am, your voice is breaking. We are not being able to hear you.
Yeah. Can you hear me now?
Yes, ma'am.
Yeah. Isolation ward. So basically, it's a dedicated intensive care beds which are required for persons with disability. So how the bed height, bed furniture, all these things with accessible devices, with other accessible provisions has to be there for persons with disability. Go to the next slide, please. Yeah. So, so one of the very important thing about is social distancing. How do you ensure social distancing among persons with disability, and how one has to make the adjustments of the beds or location of the beds, and how you have to also wear the triple layer surgical mask all the time. So how making maybe you all can develop a video on how to wear the mask and what are the various behavioral training has to be given to a child with disability, maybe intellectual disability, to wear a mask in case he's going out or in case he's in isolation ward. So these are the different challenges all of us face when we work and develop various interventions in the isolation wards, because these behavioral issues are the core in terms of where we need to pitch in and suggest interventions which are disability specific interventions as well as the mainstream interventions. Just go to the next slide, please. Yeah, suitable arrangements of PPE kit and logistic like hand sanitizer, soap, water should be in place. There should be a designated hospitals which should ensure that all healthcare staff is trained in washing hands, all kind of respiratory etiquettes, proper disposal of different kits and biomedical waste management. So now all these things are related to persons with disability wards, which are isolation ward, and how we professionals have to develop these kinds of guidelines in order to provide information to the doctors, healthcare professionals, frontline workers to develop sensitivity towards the persons with disability and allowing their parents and caregivers, because they can't, if you appoint a new professional, there's a different levels of challenges. Now, one of the key question is how, if we appoint, say, a professional, say, social worker working with the children with disability in the isolation ward, that there should be there will be a time limit. So a shift duty or these things, these technical things. So who will take care of the child or a person with adult with disability when when there are nobody around? So we cannot leave the child in alone in the isolation ward and the critical care facilities, and there has to be caregiver like mother or anyone who are ready to take all kind of risk, but do maximum for their own children. Just go to the next slide, please. Yeah. So the role of support staff now in the hospitals, when you see a quarantine center or you see isolation ward, the role of the support staff is become very, very important in terms of navigating the person in the hospital setting for going for treatment or going for therapy or going for any other kind of COVID related testing, and maybe transferring them to some other hospital for further other treatment. So all these becomes a very crucial in terms of the support staff. Yeah, next slide, please. Yeah, setting up an isolation ward for persons with disability is very, very important. Now, the guidelines which are given by the Health Ministry are basically, highlighting that, what should be done, but they have not mentioned anything on disability. But here, I would just like to highlight that, how our children will be verbal and non-verbal. So, how the hospital staff should be able to communicate to the children with disability or adults with disability using augmentative communication or different ways of communication, or being the parent if are available, then well and good. But largely, still they need to be introduced and made aware about how to communicate with, with children with disabilities, in special reference to the COVID-19 scenario, for giving any kind of treatment or any kind of thing. Otherwise, the children will become very, very vulnerable to all kind of abuse by anyone in the hospital. An isolation facility basically allows all kind of protection from all kind of airborne infections and other kind of infections. So how we need to take care? So at the state level, minimum 50 bed isolation ward should be established. Now this is all Indian standards. At district level, minimum 10 bed isolation ward should be established. So similarly, there should be signages on the door indicating space for isolation. So all these facilities should be there, and COVID-19 patients scenario, and there are no services and he's left alone. So, looking at this kind of a scenario is a very, very critical and painful, but we as professionals have to develop guidelines to tell all the hospital and other kind of health professionals to be sensitive and make sure that the care becomes a human right of the child with disability in the quarantine and isolation wards. Go to the next slide, please. Again, this is about putting them into single rooms, and there should be 3 feet distance from one bed to the other, and minimum 1 meter distance, and there should be and to create a 10-bed facility minimum of 2,000 square feet area, which is carefully segregated from other patient care areas. Now, all these things basically are technical things which are required in a ward setting, and pre and post surgical wards with other kind of dialysis and other facilities over here, medical facilities over here. Now, I want to say that, how accessibility and other measures and health and hygiene measures has to be weaved into planning and developing the guidelines for isolation ward. Go to the next slide, please. Yeah. So all other kind of, changing rooms, nursing rooms, waste disposal bins, PPE disposable bins guidelines has to be prepared with special reference to persons with disabilities, because they have disability specific needs to be, very importantly weaved for inclusion. So making COVID-19 services for persons with disability inclusive, accessible, and making sure that they are being taken care with the help and support of professionals working in the sector, NGOs, parents, special educators, all volunteers, and different other professionals who are committed to siblings and family members of persons with disability, who absolutely know the situation and struggles of the parents. Just go to the next slide. Yeah, again, this also says the similar in terms of hand washing facilities and all. Just go to the next slide again. I'm just coming to the core of my presentation. Just go to the next slide, please. In terms of the role of various professionals in developing and contributing to the interventions of persons with disability in the COVID period. Go to the next slide, please. Yeah. So so also there is a checklist we need to look at. Maybe we, this is a checklist. We have to think about preparing this checklist, because it will be helpful for all the health professionals to include the children with disability in terms of what care they need to also, persons with disability require, and they need to weave this into their checklist for isolation rooms for persons with disability in terms of eye protection, face shield, various hand wash and sanitizers, clean single-use towels, gloves, rubber gloves, all kind of critical care material has to be disabled friendly and inclusive for persons with disability. Yeah, next. Yeah. Just go to the next slide, please. Yeah. Now, isolation of persons with disability and what is the government or governance mechanism. So no inclusion of persons with disability, that is what we have seen, like the invisibility, which is starkly visible today. When you look at any government website, there's no mention on disability in terms of COVID services. So they're treated almost like in the status of invisible, in this humanitarian crisis and the global outbreak. There is a need, which I already mentioned, that disability specific needs has to be considered in preparing for the guidelines for COVID-19 and quarantine and isolation. Also, lack of budgetary provision. This is what I want to highlight here in terms of when I said the first fundamental question, that what is the government mechanism for treatment and rehabilitation as well as the of persons with disability in COVID-19 with the quarantine and isolation wards. How much budget they have? What the budget is largely used is to provide the social protection scheme of 1,000 rupees to per person with disability. Now that is being done. The ration is provided at a larger level. But what is the overall budgetary provisions which are there for the hospital care, for the treatment, for the rehabilitation in the COVID period? When the person is hospitalized, who pays for them? What is the government budget? What is the 5% budget doing over there? When we say mandatory 5% budget, every government should have for persons with disability, where is that budget going? What is a transparency of legitimacy of that 5% budget? Is it there on the paper, or is it not there at all, or it's there but it's somewhere just lying on the paper and not being, or it's implemented in that kind of a social protection scheme at a larger level? Recently I heard that one of the state, they have distributed to 13 lakh population for persons with disability and distributed 1,000 rupees, and the entire government mechanism was only involved in giving that 1,000 a doorstep to person with disability. So at that period, what happens to the other facilities which are of a high priority facilities of hospitalization, of putting them into care, ICU, or an alarming situation or emergencies? So what I mean to say that first and foremost, we need to check that what happens at the collectorate office once the information is received the person is with disability is COVID positive, or are suspected to be kept in isolation and or in a quarantine service. What are the quarantine services they have? Who are there at the quarantine services? Mapping the quarantine homes for persons with disability, and that require a chain of manpower, a strong foundation of manpower who is looking at, just go to the chain of manpower which is required in terms of creating these kinds of services. So there's a need to develop a disability district action plan in terms of COVID services, and there is a need to be a disability nodal officer in each district for COVID, and provide having all the list of resources in that district, including NGOs, parents, and also list of interventions which is already done by the mothers as lessons to be learned by the government to provide, restructure, redesign their mechanisms, their governance mechanism, to provide quick interventions, quick resourceful interventions to persons with disability. So that is what is missing, that complete missing link between the government and the parents and the organizations who are doing the services in terms of ration, in terms of various services of therapeutic interventions. But what about the quarantine? What about the actual treatment of COVID? Where is it lying? How is the budget provisions are given? Who is the manpower looking at the person with disability? So these are the alarming questions we need to ask. We need to question the government that what do you do with the treatment? How the treatment is provided. So just picking up one case one by one, taking one step at a time, look at maybe 5 cases, just follow with the government. What treatment is being done in which hospital? What kind of isolation ward services are provided? Are there accessible washrooms there? Are there accessible food available for them? Because they may be severe or high support need, which require a different kind of food for everyday life. So if they give chapati bhaji to everyone, and if this child can't eat chapati bhaji, where the mother will go back home, leaving the child alone, and make khichdi and then come back over there in the liquid khichdi. So, food in accessible format, food in accessible ways for daily living and survival, to reduce, all kind of things for person with disability. So these are the things which we need as professionals to question the government and asking them that do you have in the quarantine home accessible food facility? Do you have khichdi? Do you have other kind of liquid diets for these children? If they don't have, what is the scope of we providing you, or you give us a budget and we will make it, and we will bridge this gap. So, these are the gaps we need to pitch in order to support the government to strengthen its structure, because government has invisible to person with disability, and it will remain unless we knock the doors, we make a dent and saying that you please create these services. We are there to support you. We will help you to make the guidelines. So idea is that how these two bodies, which are service providers at voluntary level, like parents and like NGOs and all kind of services, which are very powerful in their information, which are very interested, which are very influential also in terms of bringing about the change in the government by forcing the government or pressurizing the government to do it. But if we don't create that kind of a chain of manpower and don't bridge these gaps through helping the government and creating a strong district disability COVID response committee, where this committee consists of the parents, the NGOs, the collector, the whatever professionals, special educators, doctors, community workers, psychologists, all coming together, creating this strong body and developing action plan. You can develop a 1-month action plan and see how it works. Maybe you can just map out all the quarantine services with the accessibility facilities, and maybe 2 hospitals, maybe civil hospital or maybe 1 government hospital, and seeing what is happening over there by tracking 1 or 2 cases or say 5 cases of children with disability and or adult with disability, and how the care is being taken into practice. So I think this is the kind of participatory governance where the collector is talking to the NDRF team and asking them, how many people with disability have you intervened? And if they say no, nobody, then we need to question them that what are you doing for person with disability? What is the disaster management department doing for persons with disability? So the district collectorate office or disability commissioner can actually write a letter to them that please budget 5% budget for disaster relief for person with disability. They can write to different Manrega or any other facilities for person with disability and create that budgetary programming or budgetary provision for at the governance level to strengthen the governance structure for person with disability, with the budget, with the money, with the and then contact the NGOs, contact the parents and different other professionals, which are special educators, civil hospitals, inclusive education teachers, and different other professionals working in the field. Now, one of the first thing happens after the pandemic is immediate mental health service for person with disability. Now, I can give example of my own people who are doing excellent work in the mental health field and providing the mental health care services. But what is happening in the mental health helpline is all the people are calling asking, I don't have a ration card, please help me. I don't got the food packets. Can you help me to repair my fan? Can you help me to repair this? So the basic survival questions are asked in the helpline of mental health helpline, which is provided by the volunteers. Even so all kinds of questions are flooded with basic survival existential questions. So my point is that because the professionals, because the chain of manpower is not having a concrete action plan in terms of providing basic services, ration, basic pension, and other kind of treatment and disability specific treatment to them, and that's how the things are not moving. So we need to look at the role of manpower and how all these professionals should become a part of developing guidelines for the government and creating a stronger disability action plan at the district level for COVID interventions. Go to the next slide, please. I'll be over. I'll be done. Yeah. Just go to the next slide. Yeah. The role of manpower is basically a chain of manpower where I believe that the social worker's role is underestimated because there's no mention of social worker. Only doctors are engaged, and when the doctors are tired of their all kind of services and they are diagnosed positive and then they go back, they are completely burnt out, then who will take care of all these professionals who are burnt out of the COVID interventions in the hospital settings? So everyone requires a social work interventions who can document, who can develop the care related services, who can also create, ensure that, accessible environment, or maybe write letters to mobilize resources for accessible services in terms of aids and appliances or anything, or mobilize financial resources or material help, or accessible food to the child with disability. uh, you know so all these services are required by social work professionals. The role of special educators is extremely high, important in terms of sensitize the child and the mother and the family, educate them, convert the material into accessible format, converting all the special schools into a resources to provide the care and for person with disability. Role of family, absolutely, without that how it's important to give support and care on children with disability. So here I want to and also explain the meaning of isolation, mask, all kind of practices of the new normal, I would say, in terms of developing a new practice of the COVID-19 scenario. Just go to the next slide, please. Yeah, the overall recommendations, I would say that integrated COVID-19 services for persons with disability, right from testing to diagnosis to treatment to quarantine to isolation, has to be designed, documented, and developed by, I think, all of us. So we all need to come together to create this, and maybe NIPMIT can take the lead in terms of creating and Parivar and all other organizations are also working in the sector, can really contribute as creating that kind of a strong document which will be becomes a human right of a child or person with disability to get those services from the government, as rightly pointed by Commander Bijur, that under section 25, that how emergency services becomes very essential, and they need to provide section 25(2)(j) in terms of emergency essential medical facilities and life-saving facilities has to be provided. So developing a task force with district disability plan of action, so there has to be a task force at district level. I'm sure there are, but they're not united. So I request that all these task force, which is already working, doing all kind of beautiful work, should come together and write to the district collector saying that please create a task force, please create a district disability action plan, and prepare a quarterly report. Every collector should prepare a quarterly report of what they have done, and they will require our support. So, how do we bridge this gap? By offering our interventions and services, by preparing guidelines or any other kind of services which we are already doing as professionals, we can contribute. Mapping of persons with disability needs is very important in terms of if I have to look at person with intellectual disability, I need to develop communication modalities. My treatment strategies or whatever I'm communicating, you should speak in a language which they understand. So you use receptive language, expressive language based on alternative augmentative communication or any kind of communication based on verbal and non-verbal expressions of the child or person with disability. Then 2 is restructuring the daily routine in terms of more creative expressions, music platforms, dance, WhatsApp, play, theater, different kinds of platforms. And also food, and the next is the food and water hygiene facilities to them, and rebuilding these new ways of life in COVID-19 where we can't go out, we can't do the same thing we used to do before. So, putting that in the mind of our children that this is the new life which we have to live for a longer period, and I'm sure they will understand. So disability budgetary provision of 5% budget of the total budget earmarked for each government department for use of COVID intervention for PWD. So like what we just now we heard that disaster management should have that 5% budget. And they should discuss it with the Disability Commissionerate Office and other professionals. And how should we use this budget, for what reason? And Disability Commissionerate should have all the resources in terms of the NGO list, in terms of all kind of professionals list as resource bank for them to develop interventions. Training and capacity building is a must. Crisis interventions and mental health services helpline. I told you that this is one of the very important service which is applies to all of us and for person with disability too. But what is happening in the real scenario, that other things are being asked under these helplines, which shows that there is no helpline for these basic services. So we need to look into these aspects in context of our children and adults with disabilities. Behavioral change communication is one of the communication where you actually monitor the behavioral change in the beneficiaries, whoever you're working. Either you're working with our children with disability and you use token economy, behavior modification, all these techniques in order to change the behavior and attitude towards the new learnings of our children with disabilities. So I think this is extremely important. We all are doing that, but we have to also observe and pat our back that we are also doing a good job for helping our own children with disabilities to overcome the day-to-day challenges to become a very stable person and preventing them from all mental health issues and promoting positive mental health in them. Accessible washrooms in the quarantine homes become the essential, service, non-negotiable service. Isolation ward also should allow parent and social work as caregivers, which they are not allowing nowadays. But but we should push that. Yeah, next slide, please. Yeah, so I think this is what I want to share with you all. And I just want to say that the government, how we professionals contribute to develop a positive government structure with the Disability Commissionerate Office, with all the district collectors at our state, asking them, what is your district disability action plan for COVID-19, for quarantine and isolation facilities? Tell us the budget which you have. And only giving 1,000 and ration and other things will be very, very useful, but we need to do more. We need to do beyond that in order to allow them to survive for life, in order to be, with them and enhance their social, emotional, mental well-being as an individuals with dignity and dignified life towards independent living. So, so this is what I think, that we all sitting over here in this room are resource, and our children, we can just facilitate our children to make music groups for persons with disability and fundraising for persons with disability. And out there, I'm sure music is one of the way which our children loves to, connect with. And we all love music, and as one of the rhythm where we all get connected very harmoniously with each other. So music and WhatsApp groups and these kinds of parent interventions, NGOs interventions, and committed people like Commander Bijur, who has worked for more than 35 years as a parent and as a professional in the field. And I'm very proud that I'm working with him also in early intervention center at my center at micro level planning of disability in M ward. where around 50 children with disability, we give free of cost services to them. And our artist students are working towards, family-centered interventions and home-based rehabilitation for them. So I'm very, very glad here today to be in this webinar in terms of how do we think at a policy level, how do we all collate our experiences, our lessons learned at a governance level and give it to the government that these are the ways by which parents have overcome their struggles of isolation of their own children, quarantine of their own children, and give them a very strong argument that you need to create a disability budget, boss, of 5%, and you tell us that where are you using. We should not say give us only 1%, 2%, 3%. No, we don't want to compromise here, or one or two. We are not compromising on these lines, but we want to say that it's a constitutional mandate to have a disability budget. How is the planning of disability budget happening? How is the implementation, operationalizing of this budget happening? Who is what services are being given by a district, a collectorate for person with disability? And there are multiple persons with disability in one home. For example, the father is 70 years old and he has a child with intellectual disability. So in quarantine. Now look at the irony of the situation. The parents are all become old. So there are there's invisible disability over here. Caregiving can make the person die also. So because of the burnout in the quarantine. I heard a case in Amravati that a social worker called me that we have found a child with intellectual disability on the roads, on the streets, and we found that both the parents remarried. So grandparents were taking care of this child, and the grandmother expired in 3 months back, and the grandfather was caregiving this child with intellectual disability, and with the caregiving burden he became so difficult that he's hospitalized now. So every day become a problem for survival of this child. So please suggest me a home for the child with intellectual impairment. And when we contacted the home, there is no entry for the newcomers. So here is a question that how do we really take care of our children with intellectual disability who are so vulnerable to all With this note, I end my speech here. Thank you so much.
Thank you, ma'am. Thank you so much. So now I would will hardly take maybe one more question, and then so we are already having questions like, are there any professional training for caretakers? I must say that RCI has one course for caretaker, but it was planned earlier. Now in the given situation, we have to come up with training modules and behavioral guidelines for parents and for larger community and for our children with disabilities. So the training modules and maybe the national institutes and RCI can take up this. This is a proposal. Maybe we as national institutes can take this up to develop this module along with other stakeholders, so that the training can be provided to the caregivers and other stakeholders as per the need.
Yeah, excellent.
I want to give one clarification here that today in COVID time, the most key advisor to the government is ICMR. From Prime Minister down to the Minister and to everybody quotes ICMR guidelines and they act. ICMR guideline very, very clearly says that during quarantine, personal assistance and essential support services for 3 categories of disabilities: blind persons, persons with intellectual disability, and psychosocial. For these 3 category people, their personal assistance is allowed inside the quarantine. Everyone must know This is on, if someone requires, we can send them copy of this guideline. So just to make everyone aware about this. Thank you.
Yeah. Now I would request Mukesh sir to give vote of thanks. Mukesh sir, please.
Thank you, Keerti. Am I audible this time? I understand like there were some issues in the beginning. Good afternoon, everyone. We are sorry that we are with the time. Notwithstanding that, we are going to hear good and elaborative presentations from the panelists. Our first speaker, our Commander Bijur sir, beautifully narrated the experience and needs of persons with disabilities in the current scenario. In his talk, he touched upon the need of caregiver support for persons with disability, especially persons with eye support needs. He also focused on the caregiver's well-being aspect and finally provided us the possible readjustments that are required in the current scenario. Thank you so very much, lightning talk from your end. I hope this will open up a fresh way of looking at the needs of persons with disabilities at this current scenario. Thank you very much. And our speaker, Dr. Vaishali ma'am, thank you for your elaborate. I understand it was a last minute take a glitch, and we have to put so much to get the presentation on. Notwithstanding that, your talk was very, very informative. You highlighted on the need for mainstreaming persons with disability in this COVID scenario. You touched upon the challenges that could be faced in isolating and quarantining this person with disabilities, and what could be the role of family and support staff in this scenario, and beautifully outlining the need for a participative governance model at this crucial juncture, rather than putting the responsibility on one particular group, taking it in a participative mode, collective collaboration, and doing the best possible thing for persons with disabilities. Thank you so very much. And I have to thank Keerti also, who is our own staff, who brought this idea to the table, and
Thank you,
we
sir.
are briefed about the guidelines also. And the participants, I know that we are overshoot by 1 hour 15 minutes. We started with good morning and we ended up at good afternoon. But you had the patience to bear with us with the technical issue in the beginning. Thank you so much for your patience listening. And a very big and hearty thanks goes to our director and deputy director and the technical staff who are sitting at NIPIT Secunderabad, and we extended the technical collaboration for running this webinar. Thank you so very much for everyone. And then probably like we'll be sharing the feedback form through mails to all the participants. And once if you send your feedback, probably the same link you will be getting back the participation certificate. Thank you very much for everyone. Let us all stay safe and stay healthy. Thank you.
Yeah.